Hi, my name is Jeff and I'm a third year medical student. I want to wish you a happy new year and also in this video to share with you how to recognize signs and symptoms of a stroke, because prior to entering my third year of medical school I actually didn't really know how to recognize a stroke, and right now that I'm on the neurology stroke service, every day I'm helping to take care of patients who they're really sad stories, because if they had been able to recognize the symptoms earlier and gotten treatment much earlier, then they would have been able to reverse a lot of the devastating brain damage that leads to not being able to talk, not being able to recognize their family members, not being able to move, not being able to breathe on their own. Stroke is the third leading cause of death in America. It's one of the leading causes of death in the world, and so most people all know somebody who has a stroke or had a stroke. And this is why I think it will be of relevance to your life, to my life. And if you could let your dad know, your mom know, let your grandparents know how to recognize symptoms of stroke, it would be really key. Really key. Even people who you think are really healthy. Everybody could really benefit from this. And one of the mnemonics that the many stroke associations encourage people to learn is called FAST. And that stands for face, arm, speech, and time. What that means is, so face is if somebody is all of a sudden having a little bit of facial droop, their smile isn't quite right, it's a little asymmetric, if they're losing a little bit of vision, blurry vision in the eyes, if they have a headache of unknown cause and it's really severe and it's sudden, all of these symptoms are reasons why one should immediately go to the hospital or call 911. And by immediate, it's not 5 minutes, 10 minutes, or the next day, it's immediately. The reason why I stress that is because so many people that I'm helping to take care of and my classmates are helping to take care of, they come in many hours later. So a common story would be, I was feeling a little bit, I had blurry vision for a little bit and my face was a little bit droopy, but I decided I was going to go sleep it off. And that is a really sad story, because by sleeping it off, that patient missed the narrow time window which medical treatment could have been helpful in reversing their stroke. So that's FACE with the mnemonic F-A-S-T. Arm stands for arm and leg. If you notice any loss of sensation, any changes in sensation in the arms and the legs, and movement and balance and coordination. If common story would be, just walking a little funny, or you can't move the arm as well, it's feeling a little sluggish, you lose a little sensation, that would be a reason why to immediately go to the hospital. S stands for speech, which means that if confused speech, if there's confusion, if the speech is slurred, if it just doesn't quite sound right, that's also a very important reason to go immediately to the hospital. And time, lastly, time stands for the fact that there's only a narrow time window with which a medical treatment can help reverse a lot of the serious symptoms of stroke. It's about 3 to 4.5 hours. So, and that's 3 to 4.5 hours from the symptoms of a stroke. So sometimes it takes an hour to get to the hospital and to get the team to understand what's going on, to get the images from the CT scan. So it is imperative, it is crucial to have to make it immediately to the hospital. And I apologize if I sound like I'm really exaggerating, but really day in and day out, it's been really tough for a lot of the medical students and the team, because it's really sad stories. It's the patient being fine 1 hour or 2 hours ago, and the patient then 2 hours later not being able to move, and then if the patient doesn't get help immediately, then it's permanent brain damage, and death is the most serious consequence. But then oftentimes what's really tragic is not being able to speak when you really want to, and not being able to swallow, and it's just really sad. So if you know anybody who has risk factors for stroke, it's also really important to let them know what the signs and symptoms are for stroke. For example, if somebody has high cholesterol, high blood pressure, tobacco, who smokes tobacco, who is obese, who has an unhealthy diet, please see if you can encourage that person to go see a doctor to try to prevent the risk factors for a stroke, but also very importantly to know what the symptoms are of a stroke so they can get help immediately. And I hope this video is of help because I think I knew how to recognize symptoms of a heart attack before I went into medical school. It's chest pain, chest tightness, problems with pain that's going on through the left arm, shortness of breath, palpitations, heart beating funny. I think most people know that when you have chest pain, you've got to go to the hospital immediately, but I'm not quite sure if people know that if you're feeling suddenly having a huge headache and you don't know why, to go to the hospital immediately. I think, or all the symptoms that I mentioned above. So lastly, I want to apologize for not having posted a video in a while and not having gotten to your messages in a while. I'm going to try to do so as soon as possible. After my last video, I went into the surgery rotation. It's the kind of rotation where you go to bed after you're in the hospital and then you sleep, you eat, and that's the only things that you have energy left to do, and kind of got lost track of time since. But hopefully I'll be able to start posting up again, and thank you for listening. Please do share this with your family and friends, and I hope you have a really good new year. Thank you.